survey. That's a national survey. They've had a sexual orientation identity question since 2008. And you can see that CHIS and the GSS are now tracking almost the same as of 2012. And then in the 2014 version of the GSS, their percentage has gone up to 4%. Most surveys now get between 3 and 5% in terms of self-identification. If you look at sexual behavior or sexual attraction, you get much higher figures. Usually sexual behavior, same-sex sexual behavior in the range of 7 to 8%, and same-sex attractions as high as 10% and sometimes even a little higher. But identity is fairly consistent at about 3 to 5% in most surveys. One interesting slight outlier is the recent National Health Interview Survey, which found only a little over 2%. That's largely driven by a much smaller proportion of their sample who identified as bisexual. And I'm going to talk a little bit about it today. I'm going to try to draw a bit of attention to how statistics are changing around the LGBT community. And there has been a lack of attention on, I think, the bisexual community. And there's a lot of data that says that we should pay more attention to those numbers. And so I am going to talk a bit about some of the figures around those who identify as bisexual today. So another interesting demographic group, and this was actually a subject, an application I will talk with CHIS, is I had to testify in the California legislature. There was a whole session on LGBT seniors, because we are really now approaching the first, what we call the post-Stonewall generation. So Stonewall being the moment when so much political activism happened around sexual orientation and gender identity. And many people kind of demark that as a time when it became more acceptable for people to identify as LGBT. And that generation is now aging into retirement. And much of our system around seniors isn't necessarily designed to be particularly user-friendly around issues of sexual orientation and gender identity. So this has become a pretty big public policy question. And a report done here by Wallace, Cochran, Durazo, and Ford was a brief that looked specifically at the senior population using the CHIS. And one of the findings that I think was most salient to this discussion of retirement and aging in LGBT populations is the degree to which LGBT people, or in this case lesbian and gay people, are much less likely to be living with a partner or a spouse. So for women, lesbians were aging LGBT adults. Women were much more likely to be living alone than heterosexual women, and then conversely less likely. But particularly for men, almost half of LGBT men aged 50 to 70 were living alone. And only 36% had a spouse or partner. And when we think about what that means for retirement, it means that they likely have many fewer social supports from a spouse or partner, and perhaps that also means they might have fewer supports from other extended family. And so these data were incredibly important to drawing attention to how we have to think about these issues perhaps a little differently when we think about services for senior populations who are sexual or gender minorities. With the rise of marriage, and certainly California has been one of the epicenters of discussions around marriage for same-sex couples, and a lot of attention has been given to child rearing. And CHIS, again, has been a great source and is an interesting source for how things are changing around child rearing for gay and lesbian. In this case, we're looking specifically at gay and lesbian people. So these are figures from a paper that I did back in 2008 with my colleague Christopher Carpenter that was in demography. And we looked at child rearing by partnership status, and we found that in lesbians, that they partnered lesbians in California were more likely than their unmarried counterparts to have children. and that child rearing was quite rare among gay men in California. But I ran these numbers again using the 2011 and 2012 CHIS, and you see what I think we've all started to see anecdotally, which is this increase in, particularly in same-sex couples raising children. So for lesbians, it's more than doubled, and for gay men, substantially more than doubled the portion who are raising kids. And obviously, one of the things about the marriage debate has been about the experiences of those children. And so again, CHIS can be a resource to look at those experiences, particularly over time for kids that have either LGBT parents or same-sex couple parents. Another topic, a demographic topic that Gwen mentioned earlier that we've looked at the Williams Institute, and I've looked at personally, is this issue of there's an ongoing myth about the affluence of the LGBT community. And you know, it's grounded in there is a reality that much of the corporate America has focused on the LGBT community as a consumer group, and as a group that probably is less likely to have kids and may in fact then have more money to spend on things other than their children. And that all might be true, but it turns out it doesn't mean that LGBT people are wealthier. Yes, they can spend their money differently, but they're not actually wealthier. And my colleague Lee Badgett and her colleagues did a study at the Williams Institute a few years ago in which they looked at the 2007 and 2009 CHIS, and they showed that particularly bisexual women, but bisexual women were among those with the highest rates of poverty when we looked by sexual orientation. And then I ran these numbers again in 2011 and 2012, and you see a very similar pattern. You see elevated levels of poverty for everyone. This is kind of at the tail end, I think, of the Great Recession, whereas the previous data was kind of before that hit. But much higher rates of poverty among bisexual women, and now also elevated rates of poverty in bisexual men, particularly higher than gay or lesbian people. But the other thing I would point out for gay and lesbian people is that their poverty rates are not overall lower than the general population by that much. And so the point being is there's not an evidence that they're particularly affluent or wealthy, and CHIS has been one data source in which we've been able to show that. So around the time of Prop 8 and all of that, which was the referendum here in California around marriage, and throughout the marriage debates, there has also been a kind of stereotype that gay and lesbian people don't have very stable relationships. Not many of them want to get married. Not many of them want to couple. And that has been used to try to argue oftentimes against whether it's important that we establish relationship recognition and marriage rights for same-sex couples. But again, the paper I mentioned with Christopher Carpenter, we found that in fact lesbians were, more than half of them were in partnerships or marriages, and that in fact, and that they had rates that were statistically pretty much similar to other women. Gay men we did find that gay men had lower rates of partnership, and what was interesting though is that using a different data source, the relationship length of gay male partnerships, even though they were less likely to partner, was actually longer than the relationship at the duration of their lesbian counterparts. But I also found it interesting that between the early part of the 2000s and then the 2011 and 2012, that in California at least, we haven't seen a dramatic change in those figures. They're pretty similar today as they were then. So one of the most important papers that has come out using CHIS around and that has been very influential in the policy debates has been a paper by, again, my colleague Lee Badgett at the Williams Institute and Richard Wright, who's here, And they looked specifically at same-sex relationships and marriage using the CHIS. And they were able to find that being in a legally recognized relationship diminished mental health differences, and these are generally bad outcomes, between heterosexuals and lesbian, gay, and bisexual persons. And that there are arguing that there are potential health benefits of same-sex marriage, which is certainly a significant public health issue. And that paper recently, as I mentioned, there's a case before the Supreme Court. When a case goes before the Supreme Court, people file what are called friend of the court briefs, amicus briefs. And this was one of the most widely cited social science papers in those briefs. As an example, it was cited in the brief of the American Psychological Association. And it was cited frequently throughout the amicus briefs, again, as one of the few, and CHIS was one of the few places where we could actually empirically explore the mental health impact of being in a same-sex relationship and whether that had effects that were sort of similar to those that we see in different sex relationships. So it's been a very, very important paper. Another public health area that we've looked at is my colleagues at the Williams Institute, Naomi Goldberg and Alon Meyer. They did a paper in which they looked at intimate partner violence, and this is just one example of that paper, one finding from that paper. But it looks at the odds of experiencing intimate partner violence over the last year, and this is the odds relative to heterosexuals. And it turns out that bisexual women were 4 times more likely than their heterosexual counterparts to experience intimate partner violence. And what's interesting about that is almost all of that violence was perpetrated by men. And so, and I think very little attention has been paid, and I don't think we fully understand why bisexual women, in particular among women partnered with men, why they would have such an elevated risk for intimate partner violence. So I think this has been an incredibly influential paper just to raise this question about why and to hopefully begin better research to understand that dynamic. The other group that had elevated risk was gay men. And perhaps not surprisingly, the perpetrators in that case were also men of the violence. And gay men were more than twice as likely as heterosexual men to have experienced intimate partner violence over the last year. So this really shed light on, and these findings have been replicated now. The CDC has issued a couple studies where they found very similar experiences. So again, really drawing attention to such an important issue, and in a domain that hasn't really thought much about sexual orientation and even less right now about gender identity within the framework of intimate partner violence. Almost all of the infrastructure is designed to address women who have experienced violence from men. And very little that thought about the sexual orientation of the woman and how that might be playing into it, or when the experience is between 2 men. Another health risk that's been studied using CHIS is smoking. So back in 2000, a study by Tang and colleagues used CHIS to look and showed elevated rates of smoking among gay, lesbian, and bisexual people, particularly gay men. I was actually quite pleased to find that when I ran similar numbers for 2011 and 2012, it turns out that smoking rates have declined dramatically in California among gay men. A distinctive drop that's different from any of those other groups. There has been lower smoking now in the heterosexual population, but very little change in lesbian and bisexual women and in bisexual men, but a very distinctive drop in gay men. And I think that raises questions about, well, why? Did they somehow get targeted with better messages? How did that happen? But it's clear in California from these data, the difference is strong enough that it really does suggest a fairly substantial change in the last decade and a half. So another mental health, another area in which the CHIS has been incredibly important is documenting psychological health of LGBT populations. This is a paper that actually, this is a combination of an example of CHIS as both a great survey in itself, but also for its role in fostering other data collection. In this case, CHIS provided a sampling frame for Susan Cochran and Vicki Mays to do the California Quality of Life survey that got much more detailed information on people's quality of life. And they were able to look at psychological distress. And they found that, again, bisexual men and women tended, among the LGBT population, tended to have the highest rates of severe psychological distress. And that LGBT people in general had higher rates of psychological distress in the last month than their heterosexual counterparts. I looked then at data from the 2011 and 2012 to look at whether people say they took prescription medication for emotional and mental health over the last year. And the patterns are still fairly similar. It's still elevated in bisexuals and higher in gay and lesbian people than in heterosexual individuals. So despite changes in social acceptance, we still see reports of elevated psychological and mental health difficulties in the LGBT population. Another health dimension that CHIS has been used for is looking, and this is a huge topic of debate also because there's a ruling before the Supreme Court right now around the Affordable Care Act and insurance rates, but I found this particularly striking. The study by Ponce et al. Used data from the early part of the 2001, 3, and 5 to look at uninsurance rates by sexual orientation. And they found that lesbian and gay men, particularly lesbians and gay men in partnerships, had high rates of being uninsured. But in general, lesbians and gay men had higher uninsurance rates than their heterosexual counterparts. What is interesting in the time period here is that this really is the demarcation of where California created both domestic partnership and eventually marriage that strengthened the access and dramatically improved the access of same-sex couples to health insurance. And you see a dramatic difference when we look at the data from 11 and 12. The one group that has dropped in their rate of being uninsured is lesbians and gay men who are married or in partnerships. Their rate of being uninsured in both cases dropped dramatically over that time period. So I think you can make a I'm sure if you did, this was just crosstabs, I'm sure we could do a more detailed assessment and probably be able to show the causal connection between the access to partner benefits that relationship recognition probably increased substantially in California and insurance rates in same-sex couples. Because one of the reasons why in this case we're looking at only gay and lesbian people is that most of them have a same-sex partner if they're partnered. Bisexual individuals, if they're partnered, most often have a different sex partner. So now I'm going to talk, the last part of my talk, I want to talk a bit about data collection. And as I mentioned, CHIS has been incredibly important at just advancing the field of data collection around sexual orientation. So a recent article by Jans et al., just fairly fresh out in the American Journal of Public Health, looks at over a decade and a half of the data collection in the CHIS around sexual orientation. And I cannot tell you how important it is to have this finding, which is that, so one of the challenges around sexual orientation data collection for survey methodologists is that worries about high non-response rates and how to interpret non-response. What people who don't respond, what are they telling us? Are they telling us they're uncomfortable about the question? Are they telling us they don't understand the question? Are they, what is that signaling? And the good news is that non-response has been declining, and that with the greater acceptability of sexual orientation assessment in surveys, and that the convergence across race and ethnicity language groups and interview languages shows that we can, in fact, measure this in diverse populations. This has been another challenge around getting surveys to think about adding these questions, is concerns that only very particular subsets of the population will understand these questions, particularly people who speak English, white people, that in fact, and it's exciting that we were able to use such a long period of data collection with CHIS to say that those concerns at this point, we can show that in fact we can credibly collect these data across all of these groups. The area that I'm incredibly excited about is the measurement of gender identity. And there still today is not a single population-based survey in the United States that measures gender identity. So we actually don't have a mechanism to estimate the size of the transgender population using a single survey in the United States. And there have been several methods. My own estimate relied on a different survey in California and a survey in Massachusetts. But it's still incredibly rare. I cannot tell you how important it is to have CHIS make the commitment to add measurement of gender identity to the survey that's in the field as we speak. This is a large population-based household survey. Many surveys follow similar methodologies to CHIS. If this question works and the testing that we've done indicates that in fact it does work, it really can be a game changer for us in promoting gender identity. And one of the things that we found in the testing that we did, which it makes so much sense to me now, but I'm not sure even I thought about it earlier, which is, so one of the challenges of measuring sexual orientation is that heterosexuals don't know their sexual orientation. They don't ever have to talk about their sexual orientation, they don't have to define it, and it confuses them when they're asked about it, and they represent, say, 95% of the population. And if they're confused and only a small group of them check the wrong box, it creates what we call this false positive problem, where we're worried that our gay, lesbian, bisexual sample has an unreasonably high portion of people who are not actually gay, lesbian, and bisexual, but are rather heterosexuals who don't understand the question and check a different box. And because the transgender population, by the limited data we have, is an even smaller group than LGBT people, there was a lot of concern about this measurement problem. What if people don't understand these questions? And there's this huge risk that the transgender sample then could be contaminated. Well, it turns out that most people in this country know their gender. It's not a difficult question for people to answer. So the people in the majority absolutely know what they are. So when you tweak the gender question just a little bit, and instead of asking, are you, and the option is male or female, but instead you say, what sex you were assigned at birth, meaning what was on your original birth certificate, people might think that's kind of an odd question to ask, but they know the answer. They completely know the answer. And so we get a really good, and we believe a really credible estimate of, and by the way, if you're transgender, you totally know what they're asking you here. And that signals that we're asking something about gender identity. And then later in the survey, then we can ask a traditional gender identity question in which we just say, do you describe yourself as male, female, or transgender? What's brilliant about this is, so a lot of transgender people don't identify as transgender. They've spent an awful lot of their time and resources and psychological energy presenting and living in a gender that they believe they are. And in this case, we're able to capture if someone has changed from their sex assigned at birth and now identify as male or female, even if they don't use the word transgender. And if you don't understand what the word transgender is, you know whether you're male or female again. So it turns out that when we tested this, there was virtually no problem with this measurement with this false positive issue, which is an incredibly great tool for me as someone who's advocating for this on larger national surveys, because it really does allay one of the biggest fears around this issue. And what I've now taken to saying in these settings is that unlike sexual orientation, all of these surveys are already measuring gender. They're just doing it badly. So I'm not even asking surveys to change or to add a new construct. I'm asking them to appropriately measure gender. And that's been, and the testing that's been done at CHIS, and then hopefully the results from having 2 years worth of data collection on this, I think will just be an incredibly important tool for us to get much better data on an understudied population where we have very, very little population-based data, and by all accounts a population that experiences high amounts of stigma and stress in their lives, and it would be very important to understand and be able to measure some of that. So the last little bit is just to show you some interesting findings of this sort of reflection on the last decade in LGBT demography or something like that. So first off, it's something I've been talking about a while back. So if you look at in 2003, and sorry, the chart kind of cut off, the gold bars are from 2011 and 2012. 2003 is by age group that identified as LGBT. And you see that, in fact, the highest percentage was kind of in the middle years, so in the 40s, and then it drops off as you get older. But what has changed over the last decade is the dramatic increases in young people identifying as LGBT and, I suspect, T. And you see off of the 2011 and 2012 data, there's a very clear gradient now, much more likely at younger ages, which tells me that, again, in 5 or 10 years, that the percentage who self-identify is going to fairly quickly get up closer to 6 or 7%, more similar to these younger cohorts than right now. So I think we're about to see a fairly substantial shift in the portion of people who identify as LGBT. And the composition of that LGBT sample is changing. It's becoming much more bisexual. So if we look at 2003, again, the blue bars, this is the portion among LGBT people who identify as bisexual. And you see that across all the age cohorts in 2003, only in the very youngest did it get above half. That it was well below half throughout. Now, in almost all of the cohorts up to age 45, up to 35, it's more than half, and even above 40%. And in almost every age category, the portion that identified as bisexual has increased. And given some of the obvious health disparities and socioeconomic disadvantage that we've observed, I think it is really a call for us to get better at thinking through what is it about bisexual identity that creates these associations with some of these negative outcomes around health and around socioeconomic status. And so I think that's something that has been a substantial change. Another is when we look at across race and ethnicity. So the blue and gold bars are gay, lesbian, and bisexual in 2003, and then the purple and green are lesbian and gay in 11 and 12. And so if you compare the blue and the purple, what you see is in most race and ethnic groups, there's been an increase in lesbian and gay identity, but relatively modest. Where you really see the big change in across virtually all of those racial ethnic groups is the identification as bisexual, particularly in African American populations. And what's interesting, if I could stack these bars, there's almost no difference anymore in the racial ethnic distribution of the LGBT population and the general population. It used to be skewed more white. It's very rapidly becoming less skewed. In the CHIS, it's still slightly skewed to the white population, but in other national surveys, it's now changing to be, if anything, a larger proportion of racial ethnic minorities, in part because of the skew. There's so many more younger people identifying, and minority populations in this country and in California are younger than the white population. But we have seen this difference again in bisexual identity, and it crosses all racial and ethnic groups. And in general, LGBT identity has increased, and in many cases increased more rapidly in racial and ethnic minorities than in the white population. And then the last one is this kind of interesting thing around income. So this is by income bracket, the percent of people who identify as LGBT. And what you see in 2003 is that across almost all income brackets, the portion identifying as LGBT was between 2 and 3%. It was fairly, there weren't big spikes. But in 2011 and 12, you see actually a downward movement, whereas we're in very low income populations, we're suddenly seeing much more identification as LGBT. And my argument around this is that some of that is just with social acceptance, that is now becoming much more widespread across all sectors of the population. It's not confined to perhaps more highly educated populations, and that as that social acceptance spreads, the demographic characteristics of the LGBT population are changing. And I point this out because I think this is critically important in our understanding of health disparities and other disparities related to sexual orientation and gender identity if we want to think about how these things have changed over time. The CHIS is an incredible resource that we can actually, it's one of the very few, if not perhaps the only one that I'm aware of, that's this large, where we can look at over a decade of people who identified as LGBT and look at how the things have changed. But unlike perhaps other populations, or perhaps more so than other populations, it's important to understand that when we think about the health disparities related to sexual orientation, that our underlying population of who we even identifies as LGBT is changing, and perhaps changing in ways. While we think of social acceptance as being good for LGBT health, if it means that more people with lower incomes who have higher health disparities are now identifying as LGBT, we might actually get counterintuitive results. Because the LGBT population now may have higher disparities, less about sexual orientation and more about who's identified, that it's a wider group. And so we're always, I think it's critical that we understand that the underlying demographic around identity has changed, and that when we think about analyses over time, we need to think about those changes. And I think, and again, I think CHIS is a great way for us to be able to track that, and to also track the effect of that on how we think about health disparities. So I will stop there and take questions.
Hi, Gary. I'm going to start just with an online question.
Okay.
Saying that, I'm going to read it. Colleagues nationally quoted you as saying that gender identity can be measured accurately with the currently identified question alone. Have you changed your stance on that issue? I've experienced resistance to asking the two-question version of determining gender identity because these colleagues are convinced that you do not think it's necessary. Could you repeat the question just for the mic?
Yeah, so the question, as I understand it, is about how well can you measure a gender identity in a single item question versus this two-step approach that I talked about in the talk, and whether I'm sort of abandoning a view that it's possible to measure gender identity in a single item question. I think that, so one thing is every survey has constraints, and we can't predict what questions are most viable and are the easiest to get on and perhaps work the best. There are a variety of conditions that can change my answer. to whether I think I would recommend, for instance, a single item or a two-item question that measures sex assigned at birth and gender identity. The challenge with a single item gender identity question is, again, for people who very specifically identify as male or female and who are not all that comfortable identifying as transgender or some other terms that we might use to capture what we would think of as the transgender population. But my other answer is I would rather have that question than no question at all on a survey, because I think it's critically important that we understand that that gender is not only a male and female construct, and that we need to measure that more accurately. I do think, though, that, as I said, I think there are clear advantages, if possible, to measuring to this two-step approach, although I will add that this two-step approach, one of the things we could find out in CHIS is that if there's no difference between the sex assigned at birth question on CHIS and the regular old gender question, we might be able to just get rid of that question. And that's another important thing. And that means we're only adding a single other item to most surveys. We're changing the way we asked what we thought of as sex before to ask sex assigned at birth, and then we're only adding one other question that measures gender. So in that sense, I would begin to, if we find that there's no difference in that, then I would argue that in the end we're only advocating for a single item question.
Okay, is there a question in the room?
Hi, my name is Talia. I'm a visiting researcher in Venus. I was wondering if you came across any significant findings related to citizen status.
Could you repeat the question?
Yeah, so the question is whether we see differences based on citizenship status. I haven't looked at that specifically, so I guess my short answer is no. In the CHIS, we only know whether you're a citizen or not, right? We don't actually know your documentation status.
Well, you have whether they have a green card or not.
Oh, okay.
For non-citizens.
So the comment was that we do know green card. So that's something we could explore. What we have found is, in other data that I've looked at, is that non-citizens, for instance, in same-sex couples, they're much more likely to have children than citizens in same-sex couples. Obviously, they're more racially and ethnically diverse. They have much lower socioeconomic, like they share many of the same characteristics of immigrant populations in the U.S., including, again, what I think for many people can be somewhat counterintuitive, including things like they're more likely to have children. So just being same-sex doesn't mean that you somehow don't have kids. And I should add, by the way, most kids being raised by same-sex couples are probably not adopted and foster kids, although they are way more likely to adopt or foster. But still, most of the kids are from prior different-sex relationships, most of the evidence would suggest. Another question?
Sorry, let me just go back and forth between online and audience, just to be fair, folks. Just a question about what is the rationale for not asking persons age 70 plus about their sexuality or sensitivity studies conducted to assess response?
So the rationale, and I'm now here speaking outside of the range of, the rationale. The question was about the rationale for not asking people over age 70 their sexual orientation, which CHIS has done from 2003 through the 2011 and 12. We have changed that, and in the new the version that's in the field right now, the sexual orientation question is in fact being asked all the way through the age spectrum from 18 and up. The rationale for doing that was some evidence found in the early 2000s that, particularly among older populations, that they, again, had a difficult time with the question and that you had a lot of false positives. And the example that my colleague Susan Cochran often shared was they found this disproportionately high number of widows who identified, I think, as bisexual. And in Susan's, remember I said she did a survey that was used CHIS as a sampling frame. So they were they did a call back and were able to ask some of these women, well, like, what is your sexual orientation? And they just said, well, I'm a widow. And that's my sexual orientation. I'm a widow. And they picked bisexual just because they thought bi meant two. and that meant two different, like a male and a female. And so there was a confusion. And again, because sexual orientation, LGBT identity, particularly in older populations, is an even smaller portion than younger, a little bit of measurement error created a lot of problems. So CHIS stopped asking it. The article I mentioned that was in AJPH just recently does begin to show that while that may have been a problem in the past, the evidence now suggests that as the generations have shifted, that older people, in fact, largely kind of do know these words now more than they did 10 years ago, and so the decision was made to ask all through the whole age range. Thank you.
Question in the room? Okay, then I have another online question.
No, there's a similar question about adolescence, so that's related to the age range. We can read that.
Okay, I think you sort of responded. Well, the question is, are adolescents asked questions?
And I might have to defer to my CHIS colleagues. So adolescents now are asked, they'll be asked a gender expression question, but there's no direct sexual orientation of adolescents yet. But the new innovation in this, and the argument for asking the gender expression question for adolescents is that asking adolescents about sexual orientation and gender identity, the one challenge about that is that it is a stage in life where it is a stage where there's a lot of development going on. And so it's unclear what the best way to approach. So we, in the sexual orientation world, we always said it may in fact be less productive to ask about their identity as gay, lesbian, or bisexual, and more asked, for instance, about their sexual attractions to get a sense of where they're at in that developmental stage. But also, to the degree that for adolescents we're worried about things like bullying and a lot of the challenges that non-conforming kids have around both sexual orientation and gender identity, we thought that gender expression might be a way to capture at least a piece of that, and a fairly substantial piece of that. There is evidence that much of the stigma around sexual orientation is associated still with not following people's perceived gender norms, and people who don't follow perceived gender norms experience more stigma, regardless of actually whether they identify as LGBT or not. And certainly around gender identity, then, it begins to capture some of that construct as well. So we're actually quite excited that, again, for the adolescent population, we'll have a sample in which we get a sense of non-conforming gender expression.
Any question in the room? Otherwise, we have a number of online questions. Okay, has your assessment of earnings amongst LGBT Americans changed over the past decade? Have the developments in data collection strengthened or changed your earlier conclusions in the LGBT earnings differential?
Yeah, I mean, I actually suspect that there are some. Oh, sorry. So the question, thank you. The question is about socioeconomic status and earnings in LGBT populations and changes over time. And I will say that over time there is still there has been a consistent theme of higher rates of poverty, and we're also now, and this is another thing we've done with CHIS, higher rates of food insecurity in LGBT populations, and they remain fairly persistent. So I don't think there's been enormous change. I think the change is going to come as more LGBT people are intentionally having children as an LGBT person or as a same-sex couple, which has enormous impacts on socioeconomic status and how you spend your money and even how much money in terms of childcare and who can work and who doesn't. I think that might change some of the way we think about income and income disparities. Because as I said, the idea that there was at least some measure of affluence in the LGBT population really was predicated on the idea that they had fewer children and could spend resources differently. I think as that gap narrows a little bit, that might change over time. To this day, we still observe that same-sex couples or LGBT people who are raising children have substantial economic disadvantage. But again, that's a group that had children at a young age who disproportionately had children at a young age, probably with a different sex partner and in a relationship that is dissolved now. And so it's not surprising to me that that group would show economic disadvantage. That might change also over time, because we are seeing that that form of parenting is going down in same-sex couples. And as people are less likely to have a child, perhaps unintentionally, at a younger age, their economic prospects are better over time. So again, I might predict a narrowing of some of the gaps that we see now.
Okay.
Another
we're
question?
Just going to take a few more questions.
Okay.
Let you go. Do you have suggestions for how to use CHIS data in HIV program planning? And also, will we be able to assess the impact of the Affordable Care Act on gay and bisexual men in future CHIS cycles?
The Affordable Care Act, yes, we should be able to, because we know a lot about the source of their healthcare insurance, or their health insurance, correct? Mm-hmm. So I think CHIS would be a great resource for that. I actually haven't used CHIS around HIV. Do we know HIV status in the confidential CHIS?
We do.
Okay. So there is some evidence of that. I think, and do we have sexual behavior? And we have sexual behavior questions, so that you could measure size of people who are saying recently that they're having same-sex sexual behaviors. So all of that could be important to HIV planning. I also think that CHIS, for California purposes, it does allow us to get a different kind of geographic take than some other local data collection efforts, a much more widespread take on geography of where we tend to see higher concentrations of either same-sex sexual behavior or even LGBT identity, which they're fairly correlated, particularly if we look at men in terms of HIV risk. So I think CHIS is also a great resource for understanding, getting a really wide geographic picture of California. It's again, it's one of the rare surveys that we can go below the state level and get much more detailed geographic information about some of these smaller populations.
Okay, I'm going to finish this by saying thank you to Gary. We have one more question.
Okay.
A wild card question.
Okay.
Where's your money on the Supreme Court this month?
So the question is where my money is on the Supreme Court. My answer to that is that the Supreme Court right now is making a decision, having over the last year allowed dozens of states to enact marriage rights for same-sex couples. The Supreme Court could have stopped that. They had multiple opportunities to stop that, and they chose not to. In my world, I consider that a tell. My mother always taught me that actions speak louder than words, and their actions so far have strongly suggested that they don't have a particular problem, and in fact don't have a particular problem with courts mandating that same-sex couples have a right to marry. So I'm hopeful that the decision will affirm a constitutional right that same-sex couples can marry. I think the tricky part is how expansive the ruling is and the degree to which it might then have impact on other LGBT legal cases and laws. And I have a much more nuanced answer to that, and I'm not necessarily quite as hopeful that it will be a very broad and expansive ruling. But I think my money would be on, at a minimum, that that there'll be a national right for same-sex couples to marry after the decision. So I'm hopeful. So thank you.
Thank you so much, Gary.
Thank you, everybody.